for joining us. I'm Dr. O'Connor from Longwood Pediatrics, and I'm here with Rachel Shade and Gabby Rizzo and Jay Campbell, our three wonderful behavioral health providers, and we wanted to talk to you about the transition to college, which can be both a very exciting time, but also a very nerve-wracking and stressful time. And so we thought we could share some tips and strategies to help ease that transition. And so we're just going to have a little discussion here. And then at the end, if you have more specific medical or personal questions, you can always send us a message through my chart, call your doctor, and we'd be happy to help. Jay, can you please give us a little bit more of an overview about what we will be discussing today?
Thanks, Dr. O'Connor. Your college experience will likely be one of the most enjoyable and enriching times of your life. Your friendships you'll make will in some cases be lifelong. The learning and thinking will be life-changing and will open the world for you. The social experiences will be energizing and will expand your view of people in life. At the same time, college is a new experience with new challenges, and for many, your biggest leap to independence. In the next hour, we'd like to share some advice and tips to help you navigate college life, get the most from your experience, and support your emotional health and resilience during these coming years. We'll share our expertise and what we've learned from the many patients we work with about the following: building balanced routines, having roommates, social life, facing academic demands and managing stress, the culture of substance use, keeping safe, and if needed, asking for help.
That's great. Gabby, one of the big struggles a lot of students have early on is developing a routine and finding balance. And the schedule is very different than high school. What have you learned from college students you've worked with in the past that can be helpful tips for our new college students?
Sure. So it can be a really big change going from the structure of high school where you have your academics, your sports, and your other activities, so your day kind of feels pre-planned for you. So I would recommend creating an organizational system that works for you and to try to start implementing that early on in your semester. So this is a big change, and it is okay if it takes some time to settle into. College does have a lot more unstructured time, and it can suddenly feel intimidating to feel like you have so much free time. So whether it's using a planner, a calendar, or an app on your phone, make a plan for your week. Even if it feels silly, schedule in your desired time to wake up and to go to bed and your meal times. So prioritize your sleep, aiming for 7 to 9 hours a night, and make sure that you're eating 3 meals a day. And once you have your plan, you'll see where you have time for homework, studying, and meeting your professors for office hours. Most students do find it beneficial to do homework and studying outside of your dorm, so take advantage of all of the study spaces that your school has to offer. And when forming new habits and routines, it helps to link your new habit with a previously established one. So for example, if you'd like to go to the gym more often, bring your gym clothes to class with you and go right from your class.
That's great. I wish somebody had told me all of those things before I started freshman year of college. While all that's very important, what about making time for fun? College is supposed to be fun.
Yeah, so having a plan for your week will also give you the flexibility to find time for the things that you enjoy, like seeing your friends, participating in clubs or extracurricular activities, exercising, or just hanging out in your room. It is always okay to honor your commitments to yourself and to your academics. So if you did already plan to spend some time studying or doing homework and a friend asks you to hang out, it is okay to say no.
Thank you. One of the big challenges for a lot of students is for the first time they will have a roommate who is not someone from their family. And for the very first time in college, and that's a big transition. Sometimes it can be great, sometimes it can be challenging. What are some thoughts you have that can support students as they meet a new roommate, Rachel?
So I think living with someone new can be both exciting and nerve-wracking. And if you're feeling nervous, what might be helpful is to reach out and to get to know your roommate before the move-in date. And many colleges have forums where you can get to know other people who have similar routine and schedule and expectations as you do. It would also be a lot of fun finding out what their music taste is like and what decor taste that they like, what major they're considering, and any other similarities you could connect about. It's also a great opportunity to establish a common ground like general rules and boundaries and what time the light should be off, how often friends or significant others should visit, etc.
Now, we all have heard stories about the roommate scenario where the two individuals didn't click or hit it off right away. How would you navigate that?
Well, so the one thing that I encourage all college students to do is to not put pressure on yourself that you have to be like best friends with your roommate, even though other people may have found a lifelong friend. It's normal to not necessarily connect with the first roommate that you have in your first year. It takes time to get to know a person. In this case, do your best to live civilly together as respectfully as you can. If there are other issues that you two can't resolve together, it's perfectly okay to go to your RA or housing advisor and to work towards problem solving or resolving any issues.
Great. So Jay, what are some strategies for helping build a social life at college and meeting people who are other than your roommate?
Well, in high school, you were in the same building all day and around your classmates often without too much effort. In college, that will be different. You'll have more time outside the classroom and different students in each class. You'll need to work a bit harder to meet new people and to get together with friends. First and foremost, try to get out of your dorm room as much as possible. Or if you're commuting, do things beyond the classroom. Introduce yourself to the students on the floor of your dorm. Most colleges have a lot to offer. Sports, including club and intramural, clubs, student-run groups, organized trips. They have weekend outings and college-run social events. Sign up, attend the meetings, go to events, see what you think. Eating in the dining halls is helpful, and in the on-campus cafes. Go to the library, go to campus events, such as athletic competitions, theater, music, and dance productions, cultural events and celebrations, and campus organized festivals. Meet your peers at organized events. That's great advice, but what do you tell someone who's self-conscious or uncomfortable with developing new relationships? I would say get out of your comfort zone and put yourself out there. At times, many of us think too much about what others think about us, or if they like us or not, or if we were too awkward or didn't say the right thing. Be careful about too much thinking. Our thoughts can deceive us. Our thoughts many times aren't true or accurate and can make us worry more than necessary. Take in the facts and the evidence of what you see. Not everyone will like everything you say or do, but that doesn't mean you're unlikable or not good enough or a lesser person. It means you're human.
And we're going to shift gears a little bit, and one of the main concerns that students and parents have is how to be safe in college. And not only in relationships and dating, sexual assault is something to be very concerned about, but also substance use is very prevalent in many college campuses. And we think those are very important topics to talk about. Again, if we gloss over something here or you have more questions, you can always reach out to us. So, Rachel, we all know about parties at college. We know that people drink. We know that they use drugs. We know that people start smoking cigarettes, things like that. What are some important things that students should know?
Okay. Well, I think it's important to share some statistics because it's a pretty important topic to cover. So the statistics actually show that 47% of full-time college students, when surveyed, did not drink alcohol in the past month. And 56% of college students, when surveyed, did not use marijuana in the past year. These numbers highlight that not all college kids are drinking and smoking pot. So for those not doing so or not planning to do so, you're not alone. I encourage that all college students to just not give into any potential pressure to do something they don't feel comfortable with. Make sure you know any potential risk. For instance, mixing substances can be very dangerous. If you are taking any medication or have other health conditions, make sure you're honest and consult with your doctor so that you decrease any potential dangers to your health.
And always remember, it's okay to say no. What are some things that can help them stay safe if they decide to drink alcohol or use marijuana?
Okay, here's some tips that could be helpful to help keep you safe. If you do choose to go to a party or a gathering, use a buddy system. Go with people you feel safe with and make sure you look out for each other. Avoid going to parties alone and don't leave alone. The second one is to make sure your phone is charged and you have it with you at all times, just in case. Be aware of your surroundings. Make sure you know where you are and how to get home. Try to avoid going to areas that are very remote or that you're not familiar with. And, I really encourage people to know your limits. Make sure you know how much is too much, so you don't unintentionally put yourself into unsafe or unideal situations. Don't be afraid to say no to others, and don't give into any peer pressure. This is important too, is to keep an eye on your food and drinks at all times. Don't leave them unattended or accept any from someone you don't trust. And lastly, if you're extremely worried for yourself or for others' safety, you can call 911 or have your friend do so for you. Most college campuses also have the blue light system that allows students to communicate directly with public safety should you have to do that.
Those are great suggestions. Now, another topic that's sensitive but needs to be addressed is sexual assault. We've all heard stories about sexual assaults occurring on college campuses, and I was hoping that Gabby, you could tell us a little bit more about what we should know and what students can do.
Sure. So something widely known and not often talked about is the increased risk for sexual assault on college campuses. So none of this information is meant to scare you, but it is important to be aware of. So Psychology Today refers to the time from move-in to Thanksgiving break as the red zone, which is a time where more than 50% of college campus sexual assaults are carried out, and they are often carried out by a survivor's friend or acquaintance. And they do often take place in the context of drinking and or partying. College students are at an increased risk for sexual assault for a number of different reasons, as they're away from home for the first time. Some may be experimenting with drugs or alcohol, and some may not have yet established a group of reliable friends to kind of take care of each other and look out for each other. So Title IX statistics state that 19% of women are sexually assaulted on their college campus, and 5 to 6% of men are sexually assaulted on their college campus.
Those are some sobering statistics. What can students do to keep themselves safe?
So Rachel did mention some of these strategies earlier, but I will repeat a couple of them. So if you are going to a party or a social gathering, go with people that you trust. Don't leave a party alone, and don't let your friends leave alone. If you choose to drink alcohol, monitor your drink and don't accept drinks from strangers or people you don't know well, and know your own limits. You do not ever have to stay in a situation that makes you feel uncomfortable or unsafe. You're always allowed to say no to things that make you feel uncomfortable, even if you have previously said yes before. It is never okay to pressure somebody else to do something they don't want to do, and it's never okay to be pressured to do something that you don't want to do. If you hear the word no, that must be respected, and an explanation is not owed to you. If you see a friend who appears to be in an uncomfortable situation, you can step in, because it can often be hard to speak up in that type of situation. For survivors of sexual assault, please know that it is not your fault. There are many resources available to you to support you, including your college health center, your college counseling center, and your care team here at Longwood Pediatrics.
We're going to shift a little bit. Those are some sort of heady topics. Many of you might have a primary concern. What do I do if I struggle academically? And so I was hoping that, Rachel, you could share with us some tips and suggestions there if students are struggling with their courses.
Sure. Just want to emphasize that you should never hesitate or feel bad or feel afraid to ask for help. The academic demand in college can be difficult to adjust, especially compared to your high school workload. There are many resources available that could be helpful, like the tutoring and writing centers, as well as peer supports and academic learning centers in your campus. Also, it would be beneficial to get to know your academic advisors and instructors' office hours, so you can make an appointment to ask questions and review anything if you need to. And lastly, don't be afraid to reach out to your parents or family if you feel comfortable doing so. Sometimes it can be really helpful to talk to family members for support if you're struggling.
Thank you. What are some things that they can do if, say, they're doing well in school, they're not having troubles with the other serious topics we talked about, but they are feeling significant stress? Gabby, do you have some tips there?
Sure. So stress is a really normal part of the college experience. And if you do feel stressed, it doesn't mean that you're doing anything wrong. There are a variety of stress management tools that are available to you. So as we talked about earlier, having a balance and a routine in your weekly schedule is a preventative way to alleviate stress. So sticking to a solid routine will help you prevent assignments from falling behind or past due. And making sure that you're prioritizing your sleep and your meals and your exercise will help you feel physically well enough to tackle your to-do list. But always remember to be patient with yourself, because adjusting to life at college is a really big transition, and that does take some time. So don't be so hard on yourself.
What about some tips on striking a balance between academics and the social part of school?
Yeah, so even though academics are a really big and important part of college, having a balanced life will make you feel happier and more connected with your school. So spend time with your friends, participate in activities, join clubs, and take some time to explore your campus and your new community. And so we do often think in ways that make us feel more stressed. So for instance, if you don't do as well as you had hoped to on a test, and then you find yourself feeling like you're going to fail out of school, remind yourself that that's maybe not the most helpful or realistic way to think, and tell yourself it's just one grade, you're away at college for the first time, and there are lots of resources and supports there to help you be successful in the future. Things like exercise, meditation, and therapy are all great ways to reduce your stress. And also, it's important to remember that setting boundaries and limits are also important ways to reduce stress, because it's okay to say no to invitations to spend time with others if you need a little time to yourself.
Jay, we have all encountered students that young adults that have developed depression or anxiety for the first time in college. What are some things that you can help them to look for if they're worried that they may be having those symptoms?
As in other times of life, some college students may experience stress that becomes overwhelming or face a difficult situation socially, at home, or academically, or an accumulation of smaller events. And some kids may even experience symptoms of anxiety or depression. Anxiety symptoms include feeling nervous, anxious, or on edge, not being able to stop or control worrying too much about different things, trouble relaxing, or feeling afraid as if something awful might happen. Depression symptoms include little interest or pleasure in doing things, feeling down, depressed, irritable, or hopeless, feeling tired or having little energy, feeling bad about yourself or that you're a failure or you've let yourself or your family down, or trouble concentrating. Anxiety and depression symptoms are very treatable, and in some cases, they're triggered by an adjustment reaction.
If a student feels that they are experiencing anxiety or depression, to whom and how can they reach out for help?
Great question. Longwood Pediatrics is here to help. The three of us, your doctor. You can send a message through my chart, through the portal, or you can call the office. Also, college campuses, as we've talked about, have health centers where they can refer to local help. And most colleges now have counseling centers.
What if a student is experiencing thoughts of self-harm?
If you find yourself in acute distress or have thoughts like that, there's a 24/7 national hotline. You can call or text 988 and get immediate help.
That's great. Thank you.
Also, we're here to help to better understand what's happening, to figure out how to reduce stress, bounce back from tough situations, and make a plan for any treatment or therapy to get you back to where you were.
Well, thank you all for your time today. And you should just remember that college is supposed to be the best 4 years of your life. Sometimes it doesn't feel that way, but we have highlighted many resources and strategies that you can use to get yourself back on track if you feel like your experience is not what you expected. And you can always reach us here at Longwood Pediatrics through my chart or by picking up a phone. We wish you all luck. You're going to crush it.